What is Medicare Supplement Plan N? Stick around and I'll tell you why it's becoming so popular. Plan N is a great plan to consider for your Medicare supplement, especially if you want comprehensive coverage with lower monthly premiums. The Plan N picks up the Medicare costs that Medicare Part A and B doesn't cover for you. This Medicare supplement plan works similar to a Plan G, but there's a big difference in the monthly cost. You could save anywhere from $30 or more every month with Plan N. Also, the rate increases are very stable and typically lower than a Plan G, especially with the carriers that we recommend. Let me explain how this Plan N works. Plan N covers 100% of the Medicare Part A and B copays and coinsurance, which are the gaps and holes that Medicare doesn't cover. Also, the Part B deductible of Medicare is not covered by Plan N, so you'll be responsible to pay this first every year before Medicare pays. And this deductible resets every January. The amount of the Part B deductible can change, and Medicare usually increases it a little bit each year. This deductible is applied toward your medical costs starting January the 1st every year. So for that first doctor visit, you could be billed from your doctor up to the amount of that deductible. If you don't quite meet the full deductible, then the remainder will carry over to the next visit. This works the same way with Medicare Supplement Plan G. After you've met your deductible for the year, you can have up to a $20 copay, which is a maximum copay for an office visit only, whether it's the primary doctor or a specialist visit. And there are no copays for tests, procedures, or hospitalization with Plan N. Telehealth visits, where you consult with a doctor over the phone, that's not considered an office visit, and you won't have a copay for this. There's another copay that you could have, and that's if you go to the emergency room and you're not admitted to the hospital. In this case, you would be billed a $50 copay for the emergency room visit. And if you are admitted to the hospital as an inpatient from the emergency room, then the $50 copay would be waived. If you visit an urgent care facility, then there is no copay because that's not the emergency room. One more thing you need to know about Plan N is there's something called Part B excess charges. And this is an amount up to 15% that a provider can charge in addition to the amount what Medicare approves for services. Doctors that accept what is called Medicare assignment or payment in full are called participating providers. They participate fully in Medicare and agree to accept Medicare's payment as payment in full, so they can't bill you for any excess charges. So non-participating doctors and providers that don't accept Medicare's payment as payment in full can balance bill you. In some states, by law, excess charges aren't allowed, and those states are Connecticut, Massachusetts, Minnesota, New York, Ohio, Pennsylvania, Rhode Island, and Vermont. The important thing to know is that most doctors and providers today accept Medicare assignment or payment in full, so balance billing is rare. You should still make sure your doctors are fully participating in Medicare before seeing them. So when considering a Plan N, if you go to the doctor more than once a month, then those office visit copays could add up, and you may be better off getting another Medicare supplement plan that we recommend. If you want help finding the best Plan N, please give us a call. Our service is 100% free, and we're happy to help you. If you like this video, please give it a thumbs up, and be sure to watch our other videos to help you better understand your Medicare.